Welcome to Breastfeeding with your girl Jazz. Today we'll be talking about 10 myths or facts about breastfeeding. Let's get into it. Within the first 24-hour period, it is normal for baby to feel drowsy, and it's okay for mom to wait 1 to 2 hours before offering the breast. True or false? The answer is false. So within the first 24 hours, it is normal for baby to be drowsy. Unfortunately, we do not allow baby to sleep past 2 to 3 hours. So to go an hour or two beyond the expected time of feeding, because they're super drowsy, that is correct. Unfortunately, that means their glucose level can drop, which makes them more lethargic, more fatigued, and more uninterested in breastfeeding. So we do wake our babies. We encourage them to feed every 2 to 3 hours or on demand. So that one is going to have to be false. 2, it is normal for mom to feel pain when latching within the first few days. This will decrease over time as mom becomes accustomed to the sensation of latching. The answer is false. So I like to say there's a difference between pain and discomfort. Pain is something that is not tolerable. Discomfort is something that is manageable. And so there is a level of discomfort that's, expected with breastfeeding, just because it is a sensation that most people are not used to. And there is some toughening up of the nipples that have to happen. Now, pain, I like to describe as something that's unbearable. If mom's toes are doing this, the little that is pain, and that's not acceptable. That probably means the latch is not good and we need to work on a latch assessment, or figuring out sensitivity levels, positioning baby, open the mouth wider. There are different things, but latching should not be painful for anyone. Question number 3. The newborn should feed 8 to 12 times within a 24-hour period. The answer is true. So baby should be feeding 8 to 12 times within a 24-hour period. We expect the baby to go to the breast every 2 to 3 hours for at least 15 minutes. Now, some feeds are going to be a little bit shorter or longer depending on the situation, but that is a baseline expectation. If baby is not meeting that, we do encourage additional feeding, hand expression, waking the baby up. There's different tips and tricks we can do, but baby should be feeding regularly around the clock. 24/7, 365, around the clock. Question number 4. It is best to swaddle baby when breastfeeding so that their hands do not get in the way. The answer is false. We do not like to swaddle the baby at the breast. It inhibits the skin to skin connection that we love. Skin to skin, skin to skin, skin to skin, skin to skin, skin to skin. Okay, we love skin to skin. It is great for mom and baby to bond. Also, the hormonal exchange between the two. And it also helps baby wake up and stay engaged to breastfeeding. Question number 5. Babies feed more frequently at night. The answer is true. So babies do like to feed more at night. They typically have a different circadian rhythm than adults. So meaning mom has been swaying this infant all throughout the day. And at nighttime, baby is typically more active. When they're born, they tend to keep that same sleep cycle. So at nighttime, I call it party time. I used to be a night shift nurse, and I love that my babies were awake at nighttime. Parents don't because they're tired. But for mom's sake, her prolactin level, so her hormone that stimulates milk production, is higher at night, and this helps increase her supply. Also, it helps soothe the baby. It's just a dual dynamic that's naturally happening more. So remember to feed at night. Do not skip night feed. Question number 6. It is okay if mom supplements with formula at night so that she can rest. The answer is false. So unfortunately, again, prolactin levels are higher at night. That is the milk stimulating hormone. So it is important that mom is breastfeeding at night, or she can see a change in her milk supply. That we would not want to happen. I will say everyone has a different feeding plan. My goal as a lactation counselor is to make sure that mom is reaching her feeding plan within reason. Okay, so we cannot expect mom to have a full supply if she's supplementing at nighttime and not stimulating the breast. Question number 7. Colostrum increases peristalsis in order to remove meconium to lower bilirubin level. This question is a little bit technical, so let's break down the terms. Colostrum is your milk initially right after birth. It is thicker, it is not that much, so it's lower quantity of it, but it is still packed with the necessary requirements for baby. So that's colostrum's milk. Peristalsis, that is the movement of the intestines in order to pass stool. Stool in baby's term, the first few stools for baby is called meconium. Meconium is really dark, sticky, hard to get off. Some people don't like it. It doesn't bother me much. And then you have bilirubin. Bilirubin is the byproduct of old red blood cells that the body has broken down. When it is built up in the system, it turns into the medical term or disease jaundice. Okay, so colostrum is, so the question is asking, will the milk increase the stools to lower the risk for jaundice? And what is the answer? True. So yes, colostrum will increase peristalsis to pass meconium in order to lower or decrease bilirubin levels. That one's a little tricky. If you have any questions about the logistics of that question, go ahead and leave me a comment below and I can address it in another video. 8. An initial weight loss of 10% is normal for a newborn within the first few days of life. True or false? The answer is going to be false. No, I do not want to see a 10% or greater weight loss within the first few days of life. This could mean that mom is not producing enough milk, or it can mean that baby is not able to metabolize the milk. So there are a few things we can work on with that, but no, I do not want to see a 10% or close to 10% weight loss. Question number 9. The newborn has difficulty expressing milk from the breast, so it is okay to start mom pumping. And this question is referring to stable, full-term infants. The answer is false. Baby is the best thing in milk removal, so there is a tier to this. I always say baby first, hand expression second, pumping is last. So I could hand express or baby can remove the colostrum, but if we were to put mom on a pump, we might not get anything. And that is not to say that she doesn't have milk. It's just, it's the least effective in milk removal. And sometimes that's discouraging a mom, and then she feels a sense of inadequacy. So no, it is not the best thing in milk removal. Baby to the breast is. A healthy newborn can take in as little as 7 ml of colostrum up to 123 ml of colostrum within the first day of life. The answer is false. So I'm okay with 7 ml. That's okay. But 123 ml, that's a lot. So if you think about 1 ounce is about 40 ml, then that's almost like a bottle, right? A mom in the first day after delivery is not going to be able to produce that amount of volume. So 123 is a bit extreme. That's not going to happen. Also, baby's tummy is about the size of a cherry. That's unnecessary for a baby to need that much within the first day of life. I wouldn't consider that normal. I would probably be concerned with baby spitting up or, choking on the excess milk that they've taken in. If they did consume that much, that's not normal. It's about a teaspoon of colostrum in each breast. That does not equal 123 ml. Trust me. They don't need as much as you think they need within the first 24-hour period. I hope this was fun. Okay, if you like these type of videos, please make sure you comment below, like the video, leave me other questions. And this has been Breastfeeding with your girl Jazz. Ooh, that's me. You guys take care and have a great day. Bye.